there was a notice in the Calgary Herald that said, "Come to my house if you're thinking of starting an abortion referral service." I was. Of course I was. So the six of us came to know each other very quickly, very well. We were all committed to the goal of offering choices to women so that they could then proceed with good information to make their own choices. Little by little, every single one of us at our own houses began getting phone calls from women. And we realized the incredible urgency of the task. We knew confidentiality. We knew women's own choices. We knew we had to be as well informed as we possibly could be to give everybody all the choices that were available to them. We agreed that we would never make a decision or anything even approaching a decision for a person, no matter how young, no matter how old. All the decisions were hers to make.
In 1969, the Liberal government decriminalized abortions. They set up the Therapeutic Abortion Committee, who would hear a woman's case and decide whether she qualified to have an abortion. And CBCA got their allies together. They became a lifeline for women. Calgary ended up with one of the best abortion services in the country, and it was due to the work that CBCA did.
Abortion reproductive rights was still in the criminal code, and it was highly regulated and overseen by doctors and committees, and everyone had to be very careful. And definitely the counseling, the options counseling that we provided was critical to that process.
We had only to listen to each woman tell her own story and believe her. And perhaps that was the most radical part of what we were doing.
Back in '72, the Family Life Education Program brought a partnership with Calgary Board of Education. So we were working in schools, we were working in group homes with community groups that would come into our building, and youth groups, and do sexuality education workshops, talk about sexuality, relationships, decision-making, pass around birth control methods, learn how to use a condom properly. That was a classic part of our program. And doing all of those things, what we were doing was breaking down that taboo about talking about sexuality. And I really think in a way that's kind of been, and still is, our work, is to open things up, take away the shame.
So the media attention at that time was intense, and it was intense for at least two reasons. One was that the anti-choicers were rabid. The other was that City Council had a number of councillors who were pretty reluctant around funding. So our funding was in question regularly. So we decided to be out there. We were singled out almost every year and pulled out of the FCSS envelope, because FCSS, Family and Community Support Services, was the way we got our funding. And every year when it went to council, they would pass the budget for the FCSS envelope for 149, and then they would pull CBCA out of the envelope and say, and we'll deal with them separately. And we made our funding vote, often by only one vote or maybe two. We knew that we had a specific group of counselors that were dead set against us every year. They were routine no's, so we didn't have much leverage. Again, I was young and naive, and I didn't know that perhaps other lobbying might be appropriate, which we didn't do. We just didn't know until we had the famous call from Ralph Klein. And he called me one day and he said, "Glenna, you're about to lose your funding. You haven't got the votes. You get your ass down here and do your job. You go meet with those people and you see if you can sway a few votes. Otherwise, you're going down in flames. And I don't really care, but Colleen will goddamn kill me if you guys lose your funding. So do your job so I don't have to deal with the repercussions." But it was an important time for us because we were that close every year.
Every single year, our funding with FCSS, City of Calgary FCSS, was up for review. We had to go and meet with every alderman every year to reassure them that we were, had integrity and we were professional. It was just totally fraught with people being so, I guess, really anxious about sexuality and reproductive rights. People were just like crazed about it, it seemed. We had to be the best. It made us be excellent all the time to have that kind of pressure and scrutiny, and we succeeded always.
The Calgary Coalition for Life is one of the pro-life groups opposed to city funding of the CBCA. The coalition is trying to convince Calgarians to phone their aldermen and persuade them to turn down the CBCA funding request.
I want Calgarians to phone their aldermen and tell them to vote no to CBCA. Tell them that some other service deserves the money.
But so far, aldermen such as Ray Clark haven't received many calls, and he's getting fed up with this annual battle.
They're providing other services. They're not just doing abortions or abortion referrals in that organization. Come on, folks, wake up. You know, there's more to living in a big city than just the one focus that these people are trying to draw everybody's attention to.
I remember Michael Malley chaining himself to the front of the building across the door because he was going to prevent women from going in to murder babies. I remember getting that call at work and being asked to come to the agency because there were media all over the place, which of course was his point.
Shirley Burstall, who was the head of counseling, she would go out and feed them. You know, they'd be chained to the door and Shirley would make sure he had something to eat. So that kind of messed up his plans of being a big martyr out there when people actually treated him reasonably well. But we'd have to crawl over him, step over him to get in the building.
CBCA was one of those organizations which everybody was like, well, who wants to take that organization? Because of course, it seemed like every once in a while on a Friday afternoon, late in the day, we would get a donor, a significant donor that would say that they didn't want to fund, they didn't want to donate to United Way because of what was being funded. It was quite an interesting time to work at United Way, that you know, people were really pondering what was our role as a funder to be able to fund an organization that was supporting the sexual health and well-being of such diversity. So yeah, all the way along there was CBCA was helping us to grow as a funder.
I think CBCA recognized that there was a need to serve a broader community and that there was a whole community out there that was excluded and that they needed to start looking at how they could support the LGBTQ2S community. When Deborah Bartlett contacted me, told me that they wanted to move into providing service for lesbians in particular, and would I be willing to come on the board and be part of that, moving the organization in that direction. So I was, of course, pleased to be asked to do that.
I came into the organization just when they had started doing anti-homophobia education in Calgary schools, and that was a big transition. There were some challenges or fights, quite frankly, with schools about whether we could get that in there. But it was also interesting that most embraced it. So we added on an extra session to our sex ed program, and the anti-homophobia program was developed and then started reaching hundreds and hundreds of youth with that program. So in 2012, we started a Gay Straight Alliance network. And that was really an important transition for us to say, Gay Straight Alliances happen, but lots of times they're casual, people don't really know what to do, how do they get going? And the other thing was, at that time, lots of students couldn't start GSAs. So we deliberately started it in the community so that students from whatever school system, whatever schools, could come and be part of a network. And that just grew and grew in terms of the impact that we were having at different schools. And then we were given the opportunity to partner with the University of Alberta to have Count Firefly. Community is what people need at any given time, and it's our responsibility to help to build it, not to do it. And so for me, like I talked about before, Count Firefly, the Gay Straight Alliance Network, all of that work that has built into stronger 2S LGBTQ+ communities is awesome, right? It's not work that we have to do because people are doing it, because people are finding those places. But what we start is really helping to build those connections. We have that openness so that people can do it themselves. And so, Count Firefly has to be one of the highlights to say that is where community happens, and we are simply the facilitator of that. And I love that so much.
The organization was very actively involved in human rights work, and that's what really attracted me to them, to the organization in the first place. Was this is no longer just about providing birth control and access to abortion. This is about making connections with the marginalization of many groups of people, and how, if we work together, we can forward our agendas together and collectively perhaps be more successful. And I think it worked, of course. We built great allyships across the spectrum.
We got to see some of the fruits of the labor of the many people that had come before us. There'd just been so much work done. There had been so many of the programs that are so well established today were really innovative at that time, and new and forward thinking, and in terms of some of the programs that are really significant programs like Wise Guys and the Training Center. Those things were in their early days when I initially got involved. It was so exciting to see all of the innovation that was happening. That feeling of sort of being on the outside looking in, as the center, the outside of mainstream Calgary society, I suppose. It started to change, and it seemed like people started to be inviting us in, and people wanted to know what the center was doing.
In 2007, I was starting to recognize that sexually transmitted infection rates were skyrocketing, teen pregnancy rates going down year over year over year. And I literally sat in my office one day and said, we're missing half the equation in sexual health. So we started to do some research, and it was a really interesting one because the research was showing, yes, young men were not accessing sexual health services because they were called family planning or things that we really had not provided them the ability to really step into, to be honest. And so we started to plan a sexual health education program for boys. So it could be different, they could be safe and ask whatever questions, and boom, right at that time, the area of masculinity studies began. So this time we were right on the curve.
We had been in the schools and in community groups and group homes, working with people with disabilities, all sorts of areas. We'd go in and work with the clients, do education programming, again, normalizing sexuality, normalizing the discussion with them, and then leave them with professionals that didn't necessarily have the comfort and skills. And so it was such a great opportunity to round that out and to feel solidly that you could provide the program to the staff that were working in an agency or with a group, and then go in and provide the program for the clients and know that when you left, they would be getting, again, some comfort. They knew they could talk about sexuality. And you know, if you really want to cause social change, you have to look at it from a multi-discipline, multi-pronged approach. And that's really what's happening. And I think historically, we didn't just do the abortion information. Right away, it was family life education. We need to, you know, it's just never sitting still with things.
What I hope is that we can scale our programs because we know they work. And that goes back to our foundation of education and our foundation of excellence. We do enough evaluation work and enough outcome measures to know what works in our programming. And so now it's time to take it further. And I believe that that's the next step really, is where can we go other places that need the work even more than in the city. So lots of focus on rural, lots of focus on capacity building for professionals continuing. And really, you know, I'm hoping that we can have enough young men engaged in Wise Guys in the next 10 years that we will see generational change in the role of men around the issue of intimate partner violence. I think it's really an interesting, again, sort of a paradox where you think, wow, everything seems so great and everything's about sex and sexuality, but I still think about the parents who don't know how to answer the questions, and I still literally every day think about a 13-year-old in a gay-straight alliance where that 1 hour a week is the only place they're safe in their life. So we always have to focus on that. It's just not done yet. But at the same time, I feel like society is catching up.
CBCA has really sustained itself because it has responded to societal change. It has grown and evolved, but it has never lost its spot as an agency driven by the passion to make society better and make it better for everyone. And I think that's what's made it sustain so long.
I think they've always stuck to their values. Everybody knows where CBCA stands, and that they've never wavered. They've never withdrawn support for sexual and reproductive health services, and they've always pushed the envelope.
As an organization, never been afraid to do things that other people weren't always comfortable with.
The ability to always be looking forward, to always be identifying the unmet need, the unmet, unserved populations, and always finding ways to evolve. When you start an organization like the Calgary Birth Control Association, you hope one day that it won't be needed. But that's never the case, because the needs evolve, they merge, they transform into something else. And underpinning all of it was a commitment to sexual health and wellness. And I believe that's why the organization has survived.
We never got distracted away or said, this is getting to be too hard. Isn't there another area we could focus on? And instead of saying, well, those people just don't get it, those people are never going to get it, we've always gone back. If we weren't open, and if we weren't patient and persistent and had some grit attached to kind of who we are as an organization, we wouldn't be where we are today.
One thing that has stood out for me over the years with the center's work is that as an organization, and even the individuals who are involved in the organization, the collective of that group is always ready to stand up for the core principles of the center. And it doesn't matter if that's what's popular at the time.
We should be proud of having an organization like this in the city, and I think it will continue for another 50 years because sexuality is going to be here forever, and it just hopefully keeps getting more and more accepted and more important and part of the rich fabric of our lives.
I can't think of an organization in town that's had the same kind of impact that CBCA, the Center for Sexuality, has in the past 50 years.
Well, I think CBCA was bold when they were first established.
CBCA was bold when Calgary needed it to be.
CBCA was bold simply to talk about sexuality in the 70s and 80s, despite the sexual revolution. Yes, it did happen, but that doesn't mean that all aspects of your public were familiar with what was going on. And it wasn't necessarily that we were into Playboy, but we were into saying sexuality is a healthy component of all of us from conception onward until your last breath. That was radical in that time. I think this work still continues, and I'm very happy that CBCA continues to be as bold as it is.
The Center for Sexuality was bold when we did the work no matter the support.
Calgary Birth Control Association was bold when it was tough to be bold, and lots of people wanted them to fail, and they didn't.
CBCA was bold when they took on institutions and lobbied for women's access to abortion services.
The center is bold because it's not afraid to be the first to stand up for what's right and to lead with education and to be out there 10 steps ahead of everyone else.
Center for Sexuality was bold when they supported GSAs so that every kid can feel safe in school.
The Center for Sexuality is being bold when they stand up in the face of fear, when they have stability, when they show others the way. And for me, the center's ability to be bold isn't a passing phase. It is something that is deep within them, and it's something that they've always been since 1972 to today. 50 years of being bold.
The center was bold when it was a champion for diversity and inclusion, and it continues to be bold today.
CBCA was bold when we kept our focus on choice and rights and justice.
The Center of Sexuality was bold when they provided support on creating safe places for youth. And they're still bold today because they talk about consent, and they continue to drive this message for all communities, regardless of their race or ethnicity, or whom and who they choose to love.
Center for Sexuality was bold when they did expand their scope and reach to men and boys and sexually diverse community members.
CBCA was bold when CBCA's always been bold. I'm so proud to know CBCA. I'm glad that CBCA has continued to educate everybody.
CBCA was bold when there was an issue and we responded, whether that was access to abortion information and working at the end of in the welfare office in Southeast Calgary, or when it was standing up for GSAs in Alberta. That we were bold because we always responded to what was needed and not necessarily popular.
The Center for Sexuality was bold when, present tense, They are advocating for youth in 2022 and 2021, 2020, while sort of people feel that queer youth are protected and things like that now, they are finding avenues and children and students and that still need our help. And so they are still the present, and I can't wait to see what they do in the next 50 years.
Okay, I think CBCA was bold always, and because they were bold, they made me bold. And I think that's its great strength. Going forward, all these people emboldened by what they learned, the people they met, the challenges they met, that's the beauty of the boldness with which this organization has embraced its mandate and expanded its mandate over the decades.
I think CBCA has always been bold, and with any luck will always be bold. But the time I think of as being the boldest of the bold is when those women in the 70s started this agency, knowing the risks that they were taking.
I have to say, I think that organization has been bold every day of its life. Every day of its life. And of course, it turns gold because of that. There is consistency in every thread of everything that we do. And every day we have to be bold. And we are.